Hi, and welcome to the show. Rate and review at kevinemily.com/rate. Subscribe at kevinemily.com/podcast. Today on the show, we have John Chase. He's an orthopedic surgeon. He's the author of the book, You What? Humorous Stories, Cautionary Tales, and Unexpected Insights About a Career in Medicine. John, welcome to the show.
Thank you. Glad to be here.
So we'll get into your book in a little bit, but first off, just briefly share your story and journey to where you are today.
Sure. Well, I graduated from medical school at the University of Iowa in 1980 and did my orthopedic residency in Gainesville at the University of Florida for 6 years. And then I moved to Orlando and practiced orthopedic surgery, specializing in knee and ankle work, and retired in March of 2020. That sounds a coincidence. It is. It's exactly when COVID started. So I never had to practice in the world of COVID.
All right. So as you reflect on your decades-long orthopedic career, just tell us some of the biggest changes over the years that you've seen in orthopedic surgery.
Yes, well, there's been a tremendous amount of advances technologically, but one of the things that I kind of focused on in my book, and I wanted to continue on, is even despite the technological advantages, patients still want to be talked to, they still want to be listened to, they still want to be touched. And that was one of the things I tried to focus on in the book. And I think those things are never going to go away. It's very hard to practice them now, but I think they're still really important.
So especially in orthopedic surgery, when you're dealing with a lot of devices and obviously you spend a lot of time in the operating room, how do you maintain that connection with patients and how do you maintain those ideals?
Well, one of the things I tried to do is make sure I left enough time to be able to actually to do those things, to listen and to actually explain things. Sometimes I think we allow ourselves to get so overwhelmed. I think that one of the things I said was that the best way to build your practice is a single word, and that's yes. But if you keep saying yes, you get inundated and quickly overwhelmed. So I tried to leave some time for those things. I thought they were important. I actually enjoyed it too. So I probably wasn't as productive as some of other orthopedic surgeons, but I think I hopefully I gave better care, and I certainly enjoyed it more.
Now, before we get into your book, let me ask, for those medical students considering orthopedic surgery as a career, and even to those newly graduated orthopedic surgeons, what's one piece of advice that you could share from all the wisdom that you have?
Yeah, I think I would probably suggest that you focus on maintaining enough time for yourself and your patients, particularly if you have a family. It's pretty easy to have that fall into the background. And I think you really need to spend some time making sure that you give enough time for that. Actually, when I was doing my book, I found I was found myself initially started out trying to tell stories, which there are plenty of hopefully funny stories, but I found myself talking more to my medical students and saying, do this, don't do that, be like this, don't be like that guy. And so that was one of the things I wound up doing more, and I hadn't planned on when I started the book.
Now, when you were practicing orthopedic surgery, how did you maintain that balance? How did you carve out time specifically, either for yourself or for your family?
Yeah, I specifically kept my schedule to what I thought was reasonable. I tried not to let myself get overwhelmed. I tried not to keep taking on new and larger projects that would take me away from the family. So I think I maintained a fairly good balance, but it depends on who you talk to. If you talk to my family, I'm pretty sure my daughters had no idea I was an orthopedic surgeon because I was at their sporting events all the time. They probably didn't want me there with all the advice I was giving them, but I tried to be there as much as I could.
All right, that really resonates with me as well. My older daughter, she's a high school varsity soccer player, and I did make it a point to make it to all her games. And like you said, maybe she didn't want me to share all my advice, but I do think it's tremendously important to share those moments with your children.
And you don't get them back. You can't say, well, I'm going to, I'll make it up. We'll go to the zoo this weekend. And one of the things I thought was really important is getting home for dinner and being there for dinner. And maybe you had to go back, maybe you had to go do some charts, but being there for dinner, I thought was really important.
All right, let's turn towards your book. It's titled You What? Humorous Stories, Cautionary Tales, and Unexpected Insights About a Career in Medicine. Now, John, what were the events that led you to write this book?
Yeah. I had no deep underlying desire to write a book, but my x-ray tech said, Dr. Chase, I love telling stories. She said, Dr. Chase, with these stories, you should write a book. And this kind of light went off in my head, says, maybe I will. So I took these little cards that we had, and I'd write things down. And then when I got done and retired, I sat down and took all these cards and just laid them out on the table and tried to organize them. I got some help making an outline, and I wrote the book just because I wanted to tell the stories. And as I said, I wound up adding quite a bit of advice for young people in medicine. So as I got done, I felt my goal was to try to get it out to as many to young people in medicine, and hopefully the humor would entice them to be able to read it. And it's
Yeah.
also available now on audiobook. So people that like to listen to podcasts such as yours or do a lot of listening, it's available on that too, which I was really thrilled with.
All right. Tell us one of those stories that you think is most representative from the book.
Well, there's some of the things that patients would say. It was just and that's actually was in the article in your that patients would say were just hilarious. And I literally couldn't stop laughing. One of them was, Doctor, I said, is the pain bad? And she said, no, well, the pain is bad, but not so bad that it's decapitating. And I also asked another patient about her medicines. What medicines are you on? And says, well, I'm on that. I didn't recognize that medicine. And I said, what's that medicine? She says, well, I'm not really sure. I'm in a study and I don't know whether I'm on the real medicine or the placenta. So things like that were just where I thoroughly enjoyed it, and it made it fun. And if you don't have enough time to listen, you won't get those things.
Now, by focusing on the positivity and the humor of the interactions that you have with patients, does that impact the care that you give to them?
I think so. And there's some interesting information that's been published on particularly surgeons and why they get sued. And one of those reasons they get sued is patients don't feel like they listen to them.
Hmm.
And they've said that, you take just a single minute, probably even 45 seconds, and just listen and don't interrupt. Surgeons particularly are notorious for interrupting. And just listen. They're going to think you're the most caring, kind physician they've ever met. And all you did was listen for 45 seconds or a minute. So that's one of the things that I learned along the way and tried to incorporate into what I did.
So take us into one of your patient interactions, into either the exam room or if you're doing a consult in a hospital. So give us an example of how you would include one of those minutes where you allow patients to share their story, because doctors today, I talk to a lot of physicians on this podcast, are really inundated when it comes to what they have to do, and they feel like always rushed. They have to see more patients. They have to do documentation, the electronic medical records. How do you carve out a little bit of time where patients can share their story, or you two can share a little laugh together?
Yeah, first of all, try not to overschedule. And then I really tried to stay on time. I mean, if I don't start on time, I'm never going to catch up. So I was very conscious of, in fact, I was called pathologically punctual by some people.
So how do you do that? How do you stay on time? Because that is something that is not taken for granted by a lot of physicians.
Yeah. I always tried to leave time at the beginning of the day to do all my paperwork, get all my stuff done. And then if something happened, then that came out of that time, and I wasn't a half an hour late for the office. So I'd start in the office. I'd try to be on time for surgery. It just was, I thought, respectful for the people who worked in the operating room and the doctors that were behind me. Inevitably, you get behind, but it wasn't going to be me that started it behind. And I thought that was really important.
All right. So tell us, what are some of the other main messages that you want readers to come away with from your book?
There's three main messages that I wanted to get across. The first is to be kind to people, just be decent to people. That is, I had a number of the operating room nurses that when I retired said, we just really appreciated you treated us with respect. And so I thought that was really important. And the second thing is just, and for you, I don't think you have to be brilliant to be a physician. You need to be conscientious and responsible. You need to dot the I's. You need to check that culture. You need to make sure you checked on this thing. You don't have to be, Einstein. You just have to, make sure you do all the right things. And if you get stuck, then that's what the Mayo Clinic's there for, to refer somebody on. And I never pretended to be the smartest guy, but you just do the right things. And we called that, John Wayne, the John Wayne surgery, was just get in there and do the right thing. And then the third thing that I thought was just take some time for yourself and particularly your family. You just need to enjoy yourself along the way, because if you're miserable, I don't care how much money you make, if you go to work every day and you're miserable, you just is not going to be enjoyable, and it's hard to get through a whole career.
Now, you said that you've been practicing for about 30 years before you retired. How have you changed as a physician during those decades?
I think I became a lot more cynical. I particularly in dealing with the business of medicine and dealing with attorneys, dealing with electronic medical records, all the things that, and I had a cardiologist tell me, he says, I like what I'm doing when I'm inside the room with the patient. I just walk out of the room and then it's all this other crap that's waiting for me that I don't like. And so that's what I was surprised at. I thought that it was hard to practice the kind of medicine I wanted to with all these other things that are pounding upon you all the time.
So, specific to orthopedic surgery, tell us a story. Give us an example of some of those impediments.
Well, the attorneys,
Hmm.
that was the one that I had, I had to go in. First of all, we had to try to keep ourselves from being sued. So you have to make sure that you document everything. You have to, and there's that. But I was kind of expecting that. What I wasn't expecting is the have you been injured? The people in the car accidents and workman's comp that have an attorney, and somebody trying to get something, and we are the vehicle that have to fill out the papers, do the depositions, go to trial. I felt like that was one of the things I really disliked about it.
How much
And
time did you spend doing that, going to depositions and dealing with attorneys?
I actually purposely stopped taking referrals from people that had attorneys. And because I figured if they had an attorney before they were coming to see me, then their medical care wasn't their first priority. So I stopped taking referrals, and then the word got out with the personal injury attorneys in town that Chase wasn't the guy to see because he wasn't going to give a very high impairment rating. But there's still the ones that you had to do. And so I did that, but I didn't try to add that to my practice.
Now, despite all that cynicism, the business of medicine, the bureaucracy of medicine, how did you maintain your ideals? How did you pull through that?
Well, what I thought was this is a really cool profession to be in, because I can do things. I can come out every day and said I made an influence on somebody's life. Now, hopefully it was good. Maybe it wasn't. Maybe I didn't help them, or maybe I hurt them. I don't know. But I always felt like what I was doing was significant. And then the other thing is, I told my kids, it says, one of the things you can do is you can help your friends. They call you and they say, what should I do? Should I go to the emergency room? My mother is going to have hip surgery. My grandfather just went into a nursing home, and they can ask you. And very few people tried to hit me up for free medical care. They just wanted some guidance. And that's a really cool thing to be able to do for your friends, is to help guide them in the right direction. I really enjoyed that, and still do. I still get those calls all the time, even though I'm retired now for 3 years.
So tell us about what you think about the future of medicine. Is there anything that you're worried about?
I am worried about the focus on clicking boxes,
Hmm.
electronic medical records. I have a quote that electronic medical records are like a nude beach. The idea sounds appealing, but when you actually see it, it can be really ugly. And just the focusing on not the patient, but on the boxes to click, the numbers, the ICD-10 codes, the surgical codes, all of that. It's really hard to do that. And I have a son-in-law who's been in practice for 5 years now, and so I hear all the stuff he's having to do, and it just, I'm glad I've got a lot of gray hair.
One of the things I said earlier is that you made a point to carve out time for your family, carve out time for yourself. You never overbook. Would you say that was pretty typical among your colleagues, either in orthopedic surgery or outside of specialty?
No, not at all. It's very hard to do. I was ostracized for doing it.
Really? How so?
Yeah, because I wasn't productive enough. I was not a highly productive orthopedic surgeon in terms of the figures on the sheet at the end of the month when we went to the meetings. And it was really hard to sit there and be ostracized because of that and punished in a way. So, but I thought it was important. I said, listen, I'm fine. The other thing that whatever I got worried about, okay, I'm not making enough money, or I'm not being, paid enough for this, or they don't think I'm making enough money. I said, I compare myself to my high school classmates and some of the people that, that are still farming in Iowa. And I go, if I told those people that I was not making enough money or I was not productive enough, they would absolutely laugh in my face at how ridiculous that is. And that kept me, I think, grounded. I think the problem for physicians is you're around a lot of people who have stuff, and where your problem is you get into the comparison. These people have a beach condo. Those people went to Paris. This guy has a really nice car. And if you start comparing yourself to them, that's where you get in trouble, I think. I compared myself to my high school classmates that were farming, and then I wasn't worried about it.
So when you say that you were ostracized, who was doing that? Was it the administrators? Was it your physician colleagues? Did they just have RVU productivity just put on some type of PowerPoint and you were shamed? Like, what exactly did they do?
Oh, absolutely. It was my practice partners. And they said I wasn't practicing enough. I wasn't productive enough. I was raising their overhead. And so when things changed, and it's a lot of ugly details, but toward the end of my practice, I was basically working for nothing. And fortunately, had been wise in my decisions, so I was able to maintain it. But I was basically working for nothing. So the overhead went up, and I was supposedly the cause of it. So
how do you feel about that when they approached you?
I was angry. I had a hard time sleeping at night. I thought I was trying to do what was the right thing to do, and so I just needed to get away from it as soon as I could.
Now, a lot of physicians may find themselves in a similar position. You stayed resolute, certainly during all that pressure. Any advice that you could share with these physicians who are also under productivity pressures?
Yeah, that's really hard because you're getting hammered about it. And mine was in my practice, but if you're working for a hospital or you're working for a venture capital group, that you're gonna, they can fire you. I don't have a good answer. You have to find a happy medium between doing the right thing and meeting the demands of your profession.
We're talking to John Chase. He's an orthopedic surgeon. He's the author of the book, You What? Humorous Stories, Cautionary Tales, and Unexpected Insights About a Career in Medicine. John, tell us some of your take-home messages that you want to leave with the Kevin MD audience.
If you're dealing with your patients, you just need to be conscientious and responsible. Dealing with the people you work with, just treat them decent. And then take some time for yourself to enjoy yourself along the way. I would also say something I learned about in writing a book is that writing a book is a contact sport. I have been amazed at most of the reviews, and the feedback has been good. But there's some people that have, one review started with another doctor with a God complex, ended by calling me a condescending jerk. Mm-hmm. So I began to realize that their problem, because they only read 2 chapters, their problem wasn't with me, it was in all physicians in general. So I realized that you have to have a thick skin if you're going to be in you've probably figured that out too. You have to have a thick skin because there's lots of criticism, and you just have to let it run off your back like a duck.
All right. Tell us where readers can find your book.
It's available on Amazon. It's the only place you can get it in print. The audiobook's available both through Downpour, which was the company that published it, and then also through Audible on Amazon as well, if you have an Audible. And if you like listening to stuff, I was thrilled with the reader I got. His name is Bronson Pinchot. He's my favorite reader of all the books I listened to. And he did such a great job with it. He made the audiobook better than the written book, I think. So,
John, thank you so much for sharing your story time and insight. And thanks again for coming on the show.
Thank you, Kevin. I appreciate it.